through some select slides on here. Just actually to check first, I'll just get to check to make sure that you can see the slides up in front of you. Yes?
Yeah.
Okay, great. I don't have it in slide presentation just because I'm going to jump through there, and rather than rifling through all of them, I'll just scroll to those ones that I'd like to pull out and have a little deeper discussion about. Again, as we've talked about this, we're looking at multiple options in front of you. What I'd like to do initially is just pull right down to the bottom here and talk about the recommendation, and then come back and walk through it. After this past 4 weeks and the work that we've done both internally as part of the district team and externally working with the other districts and municipal and commercial entities in Brown County, our recommendation at this point in time is to consider offsite learning as our best choice, given concerns that we have about the current status of the spread of the COVID virus in Brown County as it affects the school district. So with that said, let me walk back up to the top and talk a little bit about how we reached this recommendation. We continue to talk about the guiding principles that we have. First and foremost for us is the health and safety of our students and our staff. We continue to be concerned about the ability to bring students in and to provide the appropriate safeguards to ensure that they have that safe, secure, and nurturing environment while they're present in our schools. Obviously, the secondary consideration that we have on there is the continuity of learning. We are a teaching and learning organization, and as we heard from multiple parents last night, we recognize the importance of ensuring that our children are able to maintain academic progress as we move throughout the school year. Equity on the right-hand side of the slide here, for us means that all students have an equitable access to teaching and learning this fall. I think one of the things that we'll talk about as we walk through the conversation this evening is a significant concern that exists from community members and echoed by board members about how parents cope with a virtual learning environment that may necessitate additional childcare requirements for them. And so there's some things that we've been working on that I think can help address that, but I think that that's something that was clearly front and center in the conversation as we talked yesterday evening in the listening post. Oops, let me back up, sorry about that. I did mention the work groups. I do want to come back and just say thank you to those. If you note on the right-hand side, those who participated in the process. Again, we had teachers and paraprofessionals who helped us really give a frontline end user experience perception on how these things would impact them in the classroom. You can see that we reached out to our school nurses from a health and safety standpoint. And then from that equity standpoint, you can see multiple people in here who provided us access to folks who may wind up having a disproportionate impact with these decisions, our family engagement coordinators, social workers, and community partners to understand where we're going and what's next. So I mentioned when we were at the last meeting that we're looking at 3 different options as we went through this planning process over the last 4 weeks. As I said at the beginning, the most desirable outcome for us is all students in the classroom with all staff. We recognize that might not look like it did in February of 2020, but still that opportunity to bring students back is our ultimate goal. We'd like to do that as quickly as possible. On the other side of that diagram there is blended learning, and that is the hybrid between having all kids in school and having students off-site. And so when we think about a progression to get back to on-site, we recognize that blended learning serves as the bridge to that. And I think one of the things that came up as a concern both last night and through some of the email correspondence we've had is people's perception that perhaps if we go to offsite learning, we may be confined to that for the remainder of the year. And I just want to make sure that we emphasize to you that part of our planning process has really been to get from offsite learning to blended learning as quickly as possible, because that gives us then the opportunity to get to on-site learning as quickly as possible. So we'll talk a little bit more as we move through here about gating criteria and how we consider the opportunity to come back in front of the board and consider a change or a move from off-site learning to blended learning. In that offsite instructional model, we have looked at two. One was a choice model, and that was in the slides that were just prior to this set. And this one is actually what we look at when we consider start to this school year, where all of our students would be offsite. Most of our students would be in a virtual environment, and we would have exceptions for students who have specific needs that can be met only on site. So as you're looking at the end of that first paragraph, we're talking about our students with disabilities who have specific needs with their individualized education plans, some of our English learners, and some of our students who are at promise in services that can only be delivered on site. We also recognize that there's some concerns that have been expressed about whether or not we think we can deliver a full complement of instruction in a virtual model. We do believe we can. The teams that have been working on that have taken into consideration all of our specials. And then you'll note on the second bullet here that they've been hard at work developing and refining platforms that will allow us to better reach our students. I'd like to point out that one of the things that we talked about today with that was how we go about creating those professional development opportunities, not only for our staff, but expanding those to our parents. We recognize that parents are partners in this process. And that this is an opportunity for us to fully engage them in these platforms so that they're better suited to help their students. Social emotional health has been a key in the emails and the communication that we had last night in the listening session. You'll note on the fourth bullet here that we're looking for those grounding opportunities for students and to create a home base for them that allows them to meet in an advisory process, non-academic, focusing on their emotional well-being and making sure that they have the opportunity to maintain a consistent connection with an adult at school. And then I mentioned this earlier, I think it'll come up throughout the evening, the second to the last bullet there. We continue to work with our community partners to assess their capacity, both on-site for them or perhaps in other areas in the community, which could include school sites to provide additional daycare options for students whose parents are struggling to find assistance with their children through other obligations that they may have. Our model, and I won't spend a lot of time on this, but I do want you to understand, though, that we've started with our youngest learners, so all the way down to our 3 and 4Kers, and developed a robust schedule that ensures that there's an opportunity for them to meet in large group and small group and individually with their teachers. This allows the teachers the opportunity to provide that whole group instruction, but also to monitor progress individually. At the elementary level, you'll see that again, they're looking at the opportunity to have class, if you will, on Monday, Tuesday, Thursday, and Friday, and then looking for those opportunities to provide both enrichment and intervention on Wednesday, and then also additional office hours for students who may need some additional contact with their teacher as they're working on their academic progress. At the middle level, we've got instructional class periods on Monday and Tuesday and Thursday and Friday. I'm sorry, Monday and Tuesday, Thursday and Friday, and then on Wednesday, we've got the advisory homeroom component in there again. Once again, provides that grounding for them, and then you'll notice down at the bottom that that's also a daily part of the process. You'll notice between these two slides, high school looks very similar. East looks a little bit different with their schedule. But again, it's that opportunity to make sure that there is a semblance of a regular school day for students and that allows them to progress through their periods and to have, again, somewhat of a normal school day. I'll just stop for a moment and let you know that one of the things that the team has worked on is opportunities for teachers to be able to record classes so that students who need to go back and walk through that content again have the opportunity to do so. Or students that miss a class for a variety of reasons have that opportunity to go back and catch up and view that lesson. Out of school programs, we heard a little bit about this last night. We've also seen quite a few emails about this and share with you that we continue to defer to our state bodies who govern these activities, whether they're things from show choir to athletics. We are working with them to better understand their intent as we get closer to the start of the school year. We have some examples like show choir where the governing body has determined that there won't be any competitions for the year. The WIAA has provided opportunities for conferences to consider delaying the start of the season and shortened seasons. And so we've been working on that both within the conference and within the district. And then again, that before and after school program component, we've got some wonderful partners out there. Some are in their facilities, some are in our facilities, and we're working with them to ensure that we've got the opportunity to provide the greatest range of services for parents. You'll note in that second bullet on the right-hand side, our 21st Century Community Learning Centers are looking for creative opportunities to reach children in a virtual environment. Food service, and I know you had a chance to hear from Lynette earlier in a presentation, but I think it's important if you look at the center column on here that we're looking for both parent pickup meal locations for students and also the consideration for home delivery. She shared a little bit with you about how that would work, but it provides us an opportunity to provide some centralized locations for pickup, but also then to reach people who may wind up struggling to reach those locations. Communication, we're going to continue to make sure that to the extent possible, we're over communicating with our parents. We recognize in this time of change, and in particular the uncertainty and perhaps the required flexibility that goes along with it, that there'll be more of a need than ever to ensure that we have regular, consistent communication with parents. And then the flexibility piece on here I think is really important. You'll note over on the right-hand side that we're working with data from Brown County Health Department. And initially when we had this slide deck up, this referenced state data. At that time, we were struggling to ensure that we had regular access to county data. Thanks to Josh and Gwen and their teams for working to develop a methodology for us to do a data pull from the state so that we're able to look specifically at Brown County information when it comes to test rates and to be able to really make a decision based on local needs. I think it's important for us to acknowledge that while we may start off site with the goal to move to blended as quickly as possible, you'll notice that this isn't a linear chart. It doesn't go just from off site to blended to on site. We do acknowledge that we have to be prepared at any point in time to move back and forth between these models. And in the end, that'll really depend on public health metrics. Talked a little bit about moving between the models. Numbers, and these change for us on a daily basis. I provided both an update earlier this morning and then an update right before the meeting tonight. This is our Brown County poll. This is data through July 30th. And I'm sorry, this is actually data through August 3rd. This shows us that right now we're at 5.9% in Brown County. That's a difference. If you look at the chart there, you can see that those numbers are trending down, which is wonderful for us. May have something to do with some of the recent mitigation efforts that our municipalities have enforced. But again, it's that opportunity for us to continue to monitor this on a regular basis. One of the conversations that came up last night, it's come up through emails, is what's next for us. We'll be looking at developing gating criteria depending on the board's actions tonight as we look to toggle back and forth between those models, depending on the community spread and when we think it's healthy and safe for students to return to school. And again, pending the decision tonight, we'll start to develop some timelines. We'll bring those back to you at the meeting on the 17th. We know that our threshold is 5%. Certainly looks much better today than it did in the middle of the month when it was north of 10%. The last day that we see that in Brown County, it was below 5% was June 26th. So it's been a bit of time before we were that low. But fortunately, if you look at the trends since the middle of the month, we can see we're moving back in that direction. We've had people that have asked specifically about why Green Bay may look different than our neighboring districts. I think these two charts or maps help better understand that. These are census tracts, and again, this is pulled right from the state's website. On the left-hand side, this is actually the number of cases, so you can see how many people have been impacted in Brown County. On the right-hand side, that's the rate of cases per 100,000 people in the census tract. Certainly, you can see on both of those maps that we look substantially different than some of our other urban and suburban neighbors, and this has had a large influence for us on our decision-making process. So again, when we come to the bottom there, it's our recommendation, the district team, that we consider beginning September 1st in the offsite learning model. In order to do that, most of our students would transition into a virtual learning environment. However, we do want to reinforce that we do have students in the district that have needs that cannot be met through that virtual learning environment. And so there are opportunities for us to both provide additional materials for them at home that may be in the form of paper pencil support. And then we also have some students that will need assistance on site. And our departments have been working to determine how best to centralize those services and provide those to parents and students in a manner that allows them to comply with things like their individualized education plan or our expectations for English learner services. Just real quickly, the rationale on there. Probably the biggest point for us is that reliance on medical professionals. A large part of the work that we've done over the past weeks has involved people from the medical community, from Brown County Public Health. We've been listening to them and understanding their recommendations based on the numbers and the data. They've helped us determine what gating criteria are to return to that blended learning model. We certainly appreciate them and their willingness to step up and help us better understand the science behind that. We are concerned that Brown County is still the third highest transmission county in the state. We continue to watch the state data to better understand which direction Brown County is moving and at what rate. And then down at the bottom there, you can see that a couple of resources there for us to look at both at the local level and at the state and the national level. So with that, I'm going to stop sharing, bring us back to our full screen, and I'd like to entertain questions that you have or defer to the board for discussion.
Dawn?
Dawn.
So Steve, some of the board was able to go to Chapel today and look at what buses would look like and classrooms would look like if we would do in-person instruction in fall. And what I took away from that is that with our numbers the way they are right now, we currently cannot meet CDC guidelines for 6 feet of social distancing, either in the classrooms or the buses. Is that accurate?
Well, I tell you what, if you would indulge me, I actually have a very short video that Lori put together based on our time there. And if it's all right with you, I'd like to show you that very short clip. It's just under 2 minutes. Would that be all right with the board?
Thank you.
All right. All right, I'll look for a thumbs up from Eric since I can actually see your face on the side of my screen. Are we good here? All right.
Yeah, we're good.
There's no audio with this, so it's simply the walkthrough of our time today. Thanks to those board members who were able to make it. We also, you'll see in here that we had representatives from both first student and lamers. They were able to bring a couple of buses so that we had an opportunity to see what those look like. A few brave souls were willing to get on the bus so that we could take some photos so you could see what the distancing looks like. So with that, we'll start this. So this is a classroom that shows how we would align the desks. And one of the things that we've done is we worked to make sure that we pulled out all the soft spaces in there. So you see that there aren't rugs, there aren't soft seating areas. Unfortunately, that means some of the things like our mindfulness areas are no longer present in those rooms. This gives you an idea what 6 feet looks like in the hallway as we line up for restrooms. Our physical plant team has worked really hard to manufacture some plexiglass shields that we could use between students if they're at tables. Here's an entrance to the bus. You can see the bus companies have done a wonderful job with signage and helping students understand what the expectations are on the bus, where they can and can't sit. You can't read that. It says safety dog, says pause off. One of the things we'll do is to make sure that we reinforce that students are being very careful from a sanitation standpoint. You can see the sanitizer there for them to use both when they enter and when they exit the bus. Again, here's some of us on the bus earlier today. The rule will be only one student per seat unless it's a family member. In that case, we can put more than one to a seat. As somebody pointed out today, that does not meet the 6-foot CDC guideline, and that is correct. We simply don't have enough buses or enough time to run them at that 6-foot guideline. This is an example of how we might have to use bathrooms during the course of the day. We have to schedule them to ensure that students actually have the ability to get in and out without crossing classes. One of the concerns that was shared today was the impact on instructional minutes. One of the challenges that we had with instructional minutes as we looked at the schedule was in order to get the restroom breaks, the recess breaks, the lunch breaks in there, and do that in a manner that allows us to keep the students physically distanced during those times. We reduce our normal daily instructional minutes from 420 down to 215 or less. And so that's definitely a challenge for us, but unfortunately, given the requirements that we have to make sure that students are safe in the classroom, that logistically is one of the things that we'll have to do to ensure that our students can travel about the building without interacting with each other.
Christina?
Thanks, Eric. Steve, can you just give a little bit more context to, why the rooms are so bare? I know we saw in the video that there wasn't, the carpeting there, but can you talk a little bit more detailed how that connects to the guidelines from the CDC and through the Brown County Health Department?
Sure. So one of the challenges that we have is keeping things sanitized. And you were looking at elementary classrooms there. Elementary classrooms have lots of manipulatives in them. That is various learning devices that students are actually using in the classroom. We are unable to ensure that we have the ability to clean and sanitize those on a regular basis if we had as many of them in the classroom as we normally do. So one thing you really couldn't see in that one was in the back corner of the one room, there was actually an area for block manipulatives. And those were set up in such a way that one student would be able to use those during the day. Then they'd have to be cleaned that evening, and then a different student could use those the next day. So for instance, if you had 10 kids in that classroom, that particular set of manipulators would be able to be used by a student once every 2 weeks. So the rest of the manipulators have been removed from the classroom. We want to make sure that the room is safe, and we certainly don't want extra temptations in there for kids. And so those pieces have been pulled out. I mentioned that most rooms have had mindfulness areas in them, which is a place for students to go if they need to disengage and reset so that they're ready to participate in a lesson. The problem is that we're running out of physical space. So in order to maximize the number of desks in there, much of the environment that you would normally see in a classroom has been removed.
Thank you.
Go ahead, Christina.
Sure. I move that the administration's recommendation that instruction begin on September 1, 2020, and a primarily off-site instructional model with exceptions for individual students, free and appropriate public education requirements, and that the model be reviewed on a weekly basis using the gating criteria of a 14-day trend of 5% or less of Brown County COVID-19 testing being positive as presented be approved.
Is there a second? Second. All right, so we have a motion on the table. We will go to continue the discussion. Rhonda, if you'd like to start us off.
Thanks, Eric. So I have several questions. A lot of these came from staff as well as families. Starting off with the structure of the day, I noticed specifically in the high school, it says periods 1 through 8. So is that basically the teacher instructing periods 1 through 8 as if school was happening in real time?
Yes, that's the intent behind that, where possible, we would like to have as normal a school day as possible for students so that they are participating in their classes as if they were physically present. One of the rationale behind that is we remain hopeful that This is a short-term solution, and we have the opportunity to transition back to a blended learning platform and eventually to an on-site learning platform. And in order to do that, we want to make sure that that transition is as seamless as possible. So having students start with their regular schedule and their regular day hopefully allows us to make that transition easier for students as they work back onto campus.
Okay, and to that point then, so are you saying that they log on, let's say at 7:30 in the morning if they're middle or high school, and then is it where they have a few minutes between, is it like consecutive hour after hour after hour after hour online? Is that what you're saying?
Well, yes and no. So first of all, we understand that that is a long day for those of you that participated last night. 4 hours was a long time online, but what we want to do is we want to make sure that that period is available for that class each day. There is the flexibility for instructors to provide activities for students that could be done both collectively together. So then that would feel a lot like class, but there also may be some independent activities that they may schedule with those students that would not require them to be on that particular class period for that day. So there's an opportunity for flexibility there as the teachers develop both what you would consider to be the in-class and the independent activities.
And you had stated that they would actually record those periods potentially?
Yes, that's the idea behind that, recognizing that if we run a regular student day, all children may not get up on time to get to their first period class. And so we want to ensure that if for any reason a student misses a class, they have that opportunity to go back and see that. And we also recognize that some kids may want to be able to go back and review a class just in terms of catching up on the concept and getting some clarification.
Okay, and so because we had heard from a lot of families who actually had discussed that they're going to be working through the entire day and that they may not be able to, the kids are not going to potentially be able to access that in real time as it's going on. Will staff be available after hours in case there are issues, just needing,
yes,
especially not to fall behind, right? So that people aren't falling behind.
Yes, that was a big part of our conversation today. What we'd like to be able to do is to ensure that we have a range of staff that are available outside of regular student hours. So that would be regular classroom teachers, but also think about folks like our counselors, our librarians, people who provide technology support. So a broad range of staff who would be available every day. It might be different people each day, but there would be people available outside of regular school hours that would allow students and also parents to reach out to them and get support outside of that regular student day.
And do you anticipate any staff being on site to do the classroom instruction?
Yes, we've had conversations about, and lots of requests actually from staff who've said, there are things that I have in my classroom that allow me to teach better. And if I've got access to the equipment in my science classroom, if I've got access to math manipulatives that I don't have at home, I can do a better job teaching my children. And so there's an opportunity for us to work with staff to determine how to safely and effectively allow them to access their classroom. And again, then as they go through that process of videoing and recording their classrooms, that could be done right on site.
So when you say allow them into their classrooms, then am I hearing correctly that maybe this won't be required? It'll be something that they have a choice about.
We talked about that, and one of the reasons that we're not looking at requiring staff to be in there is we have staff that have health compromises that would prevent them from being present in the classroom. And if we required all staff to be in there, people who might otherwise be able to teach from home would have to have a medical dispensation, and then they would not be teaching at all. We'd like to maximize the number of teachers that we have access to and to ensure that as many teachers as possible can continue to work with their kids. We would have that opportunity for them to teach right on site or from home. We also recognize we may have teachers that get sick during the course of the year. And if they test positive and they have to be quarantined, we don't want to be in a position where we have to have a substitute teacher in there when that teacher could transition to teaching from home and maintain that continuity for their students.
And when it comes, Sorry.
I was just going to ask you, just if you have a lot of questions, maybe we break them into 2 sections and see if anybody else wants to go, and then we'll come back to you. But if you just have a few more, then just keep going.
I have quite a few questions. So
So yeah, maybe we'll, ask maybe one more, and then we'll see if anybody else wants to go. We'll come back to you just to keep
that
it
sounds
moving.
fine. That sounds great. So when it comes to, you talked about instructional minutes, and you mentioned, you said something about 420 that you would potentially have to go down to, what was the number, to what?
When we tried to mock up a schedule, given the requirements that we had for the restroom breaks, the lunch, et cetera, they were looking at potentially as few as 215 minutes in that particular model. So again, that's part of our work on what a blended platform would look like, and certainly taking into consideration some of those concerns we have about health and safety for students.
Okay, so when it comes to instructional minutes in the offsite virtual model, that's the recommendation, what do you anticipate? Are the instructional minutes the same as they would be in a, I guess, normal, regular school year at this point? And what are you doing as far as participation for students when it comes to whether or not they're participating in the offsite virtual model or not? You know,
Sure,
what's the leverage there?
So in terms of the minutes, the anticipation right now is that the offsite minutes would be the same as our regularly scheduled onsite minutes. Our challenge with the blended is that we've got a lot of procedural pieces that we have to take care of. If you noticed on the video, there was a segment there that showed the restroom breaks. And in order to cycle students through the restrooms, we have to have them there at specific times. Same thing with lunch, same thing with recess in order to maintain that physical distancing. So those impinge on our ability to provide those instructional minutes, because you have to have some very structured times out of the classroom in order to address things that might be taken care of in the normal flow of the day. In the on-site model, the anticipation is that we would have the same number of instructional minutes that we currently have. And then your leverage question. So I think one of the things that people asked last night, and we've heard in a lot of the email dialogue, is frustration with how things worked in the spring. And our team has worked diligently to improve that. And I think one of the things that people would see is that this would feel very different than it did in the spring. It would feel more like a regular school year. And so you're having attendance taken on a daily basis through that homeroom process. That allows that trusted adult to maintain connection and communication with the student. So therefore, if a child doesn't show up in a classroom right away, we're going to know about that. It gives the support staff at school the opportunity to reach out and do that well child check and see if there's a reason that that particular student wasn't engaged in learning that day, and provide some immediate follow-up to that.
But I do have a follow-up to that, and I'm just wondering about what you think as far as if the student isn't participating. If we have students, we know that there are students that may not participate. That's just a fact. So what happens to these students? Are they falling under the truancy laws of the state of Wisconsin? What happens ultimately to the families who may be experiencing this for all kinds of reasons? Is it, again, the same as the prior school year when we were not in a pandemic? What responsibility and who's responsible, and what does that look like as far as being punitive?
Well, I'd say we're responsible for the engagement piece, right? We're opening our virtual doors up. We're inviting those students in to participate. We're taking attendance. If those students aren't attending, that obligation falls to us to follow up with the children and their families, to figure out why it is that they're not attending and what we can do to help them be in attendance on a regular basis. And so our teams would be doing that, and those would be building level teams that would be doing that follow-up, and hopefully they're already have or would be developing that relationship with families that allows them to have that dialogue. The truancy piece is actually, when you think about it, those are those compliance pieces that we have, whether it's assessments that come to us from the federal government, or attendance requirements that the state has. And fortunately for us, at least at this point in time, we've got quite a bit of flexibility through the Department of Public Instruction. They've been very amenable to either making direct changes to the rules that are within their purview, and if not, their willingness to advocate with other agencies in the state to make those changes has been very apparent. And so the plus for us is that we don't have to look at being punitive through the truancy process because that's not a requirement for us at this point in time.
So whatever the waivers were last spring, they've carried through to fall? Or are you stating that they're still accurate? They're still active?
They've changed. So the Department of Public Instruction meets with us on a weekly basis, superintendents from throughout the state. We continue to petition them for things that we see as necessary for us to provide either, for most of us that are talking to them, either an offsite or a blended model. And again, they've been very receptive to those changes. Essentially, they've said, as you work through this process, if you find something that doesn't work for your children or their parents, they expect us to communicate with them, and they expect to work with us to make the changes that will work for our kids. The only area where there's an exception to that is there are requirements that come from the federal government. For instance, assessments, I know has been a question that we've received quite a few inquiries about. Many of those assessments are federal requirements. And the DPI at this point in time doesn't have the latitude to waive those. They have expressed to us, though, that any of the assessments that they do have the latitude to waive, they're willing to waive, and those that they don't, they're willing to lobby with the federal government.
Okay, I just have one more question about that. You said they've changed. How have they changed?
I'm sorry, what's changed?
You said that the waivers have changed. How have they changed?
Which rules?
When I was asking about the waivers, you said, well, some of them have changed.
Oh,
so I'm asking how they've changed.
Sure. So many of those had fixed timelines on them. So they were set to run out at the end of the year. As the DPI has rules that they have jurisdiction over, others the state legislature has. And so those that the DPI has the ability to make exceptions to, they're in the process of, they've either done it or they're in the process of doing it now. But those that the DPI or the state legislature waived last year expired at the end of the school year, so they had to reinstitute those now for the start of the next school year.
All right.
Okay.
We'll go around. Brenda, why don't you go, and then we'll go to Andrew.
Okay. One of the questions I have, Steve, is very specific. A mom was asking me if she were to decide to homeschool this year, and she's also an intra-district transfer into our district. Would she be able to still remain as an intra-district transfer a year from now? Does she lose that spot because she hasn't enrolled in school?
I believe the answer to that is no. Obviously, inside our district, we have a lot more jurisdiction. So the intra-district transfers inside would hold. I know questions that we've received from people are, what does this mean if I'm in one of our choice programs, and will I still be able to remain a student there? The answer to that is yes. That we've said that people will be able to hold their slots in those schools.
Steve, could I just add a
Sure.
point to that? So maybe this would be easier to clarify. If attendance is broken, Brenda, by leaving the district, so enrolling in homeschool or enrolling in a neighboring school district or a private school, that will break a student's interdistrict transfer, and they will be required to reapply. If they remain here in the district and they choose the virtual option, so for example, they're as Steve was saying, they enroll in one of our choice programs like Da Vinci or Aldo, they would maintain that attendance if they're choosing the virtual program when we are able to come back on site and remain in that virtual program.
So if they were to, but if they were to not attend and they wanted to just homeschool their child, would they still retain that inter-district transfer spot? No. Okay, they have to be enrolled. They have to be enrolled in some way in our school to keep their spots.
Correct.
Yes. Okay.
They're unenrolling, yeah.
Correct.
They're essentially unenrolling by not attending.
Well, for purposes of homeschool, you are unenrolling from the district. So that breaks your attendance with the school district.
Okay. All right. Thanks. And then,
Actually, that's a good distinction to make, because I know we've had quite a few emails where people have talked about what if we come back into a blended model, and I'm not comfortable, and I want to stay in the virtual model. And they unfortunately sometimes refer to it as homeschooling, and obviously that's not. That's still being enrolled in the district, just selecting the virtual program. And in that case, you would still retain your position in that program because you'd still be enrolled in the district. You would just be electing to have your child at home in the virtual model as opposed to being in the blended model.
Okay. And then are we having, or are schools having conversations about having any kind of in-person parent, child, teacher meetings and things like that to, for certain families, or has there been any kind of conversation around those kinds of personal interactions?
There has been. They have not gone into much more detail about that. One of the things that I had shared with the teams as they went through this was we wanted to get as much detail down as we could about the two models that we thought best met our kids' needs. But then there were some things that I said, let's make sure we get that piece done, and let's allow the board the latitude to make a decision, and then recognize we'll have 4 weeks after that to fine tune many of those components of whichever model is selected. But yes, that has been discussed. It just hasn't been fleshed out yet.
Okay, thanks. That's all I have for now, Eric.
All right, we'll go to Andrew.
Thank you. I'll have questions in a variety of areas, but I'm going to start off with the metric. So the motion that was made says the model be reviewed on a weekly basis using the gating criteria of a 14-day trend of 5% or less Brown County COVID-19 tests. Before I get into the merits of whether or not positive test metric is the one to use, I need to know what the definition is of a 14-day trend of 5% or less.
So we're pulling the data, and again, I'll tell you right now that my area of expertise lies in public education and not public health, and certainly not medicine. So we deferred to others to help us understand the appropriate selection for the gating criteria. And by that, I mean both what metric to use and the length and the numbers. And so the recommendation to us was that on the state data site, we're able to look at the daily positive test rate that allows.
I'm more specifically, what is the definition, before you even get to that, what is the definition of a 14-day trend of 5% cases? I know what 14 days in a row of 5% cases looks like. I know what statistically significant declining trend looks like, but I don't know what a trend of 5%, I don't know what that means.
It's the 14-day rolling average of those positive test rates as reported by the state.
Andrew, the way we're calculating that on that chart is the sum of positive tests over the past 14 days over the sum of all tests over the past 14 days.
So then, right, but that would be, so that's, right, good, that will smooth out the jumps, but then if you will have days as you get closer to reaching the metric that you'll be bouncing back and forth. So what does trend mean? If I'm, so today is off of the 2 o'clock numbers, I believe brings us down from 5.9 to 5.7. So are we checking? So what happens when it's 5.2, 4.9, 5.1, 4.7, 5.3, which will happen because the days you're subtracting off from 2 weeks ago might be high days, might be low days. So
right.
The key is that, before we get to whether the positivity rate is the thing to do or not, knowing what trend means may sound picky, but it's extraordinarily important, because to be able to vote for something, I need to be able to tell people what that means.
Certainly. So we're looking at it every day. And by looking at it every day, we're going to be able to look backwards and see where things are at. On that one chart that I showed you, clearly you can see over the last 5 days, that the number has been declining each day. So that helps us better understand where we're at today and where we're going. And so our goal is that as we see the line moving towards 5%, for us, that's a trigger to move forward with the next steps in the move from offsite to blended. Gives us the opportunity to reach out to you as a board and ask you to calendar it for a decision. Allows us to start working with our parents to ask them, given the information that you have available to you now, how many are ready, willing, and able to send your students back to school. Check with our staff to see if there are those that are unable to return for health conditions, so that when we get to that next board meeting, we have enough information for you to make a decision. Obviously, we'll have multiple days where we can look at day upon day upon day and look at those numbers, because you're exactly right, Andrew. There'll be a little bounce in there, but if we see that it appears that we are closing in on that 5% number, then that gives us the opportunity to request from you the permission to move from offsite into a blended model, and then reach out to our parents and set a timeline for them for the return of their kids to class.
So are you not proposing automatic triggers?
Well, at 5%, what we're hearing from our public health professionals is 5% is the number that they're saying is safe for us to return to class. And so into on-site through a blended process. And so that's our goal, is reaching that and bringing students back into that blended model. But keep in mind, if we'd hit 5% today, or if we were at 5.2, 5.1, and we had been in that range the last 2 or 3 days, you as a board don't meet for 2 weeks. I think it's responsible for us to make sure that if we see ourselves where we think that within that time frame that we will be safe to return to a blended model, we want to be able to initiate some of those steps prior to arriving at the board table and asking for your vote for that move.
So okay, yes, but would this motion mean that when 5% is reached, hybrid will start?
Well, it wouldn't start the next day.
Does it mean that if 5% is reached, the board will be asked if it's ready to start hybrid?
Yes, we will come back to you and ask for a vote for the move. We will not make a unilateral
so that is not
move.
You're not asking for an automatic trigger.
No, we will come back and we will ask you. We think that 5% is that number that we're shooting for, and we want to make sure that if we're in that position, we don't want to come to you 2 weeks from today and say, hey, what do you think? Should we do it? We want to make sure we're taking some of those preliminary steps so that if you say yes, we're prepared to do so sooner rather than later.
So I think people might be expecting there to be a rule, though, so that people are going to be afraid that it's going to be 5%, but you didn't feel like it, or 5%, but maybe there's not going to be 4 yes votes because that social distancing sounds pretty awful, right? So I guess I had always seen this as having automatic triggers, which obviously doesn't mean that if on Sunday night the 14-day average finally touches 5%, we open tomorrow, but it also can't be. So I guess I wasn't expecting that this would be something other than an automatic trigger.
So my suggestion would be, if you'd like an automatic trigger, when we come back and talk to you about a reentry and a transition from offsite to blended on August 17th, if you want an automatic trigger in there, then I think we should bring to you a very definitive calendar that spells that out and then answers those questions that you just asked, so that people know when we get to that point, is it 2 days, 10 days, 20 days before their kids come back to class? And we can certainly do that for you. I guess I looked at it from the standpoint of our previous discussion. I certainly don't want to usurp the board's authority. And so if that's the intention of the direction that the board would like to go, I think we can definitely bring back to you a pretty specific timeline. But I don't want to get out in front of ourselves, and I certainly didn't want to take away that decision-making process from the board.
And I don't know what the answer is there. And ultimately, you know, I was thinking of situations too where could there be a situation where a metric was reached, but the board in good conscience, everyone knows it was reached for a strange reason. The example I give is, God forbid, a huge case spike, but the CDC shows up with 100,000 tests and everyone gets one. That might look good from a testing metric, but obviously you're not ready to start if there's hopefully not, but if there would be 1,000 new cases. So obviously there could be times that the board would have to do something different, but I also think if it's passed as it is, and that's not an automatic trigger, then you're faced with voting yes on an indefinite, like I thought the vote tonight was going to be on a, perhaps on going off-site until however defined the 5% metric has been reached. And so if we're not, then we're in a position of voting for something that's open-ended and subject to, you know, further board votes, though anything could be subject to further board votes. I guess I'll finish up on metrics and then I'll let someone else have a turn. I have other areas too, but why the positivity metric, and do we have a healthcare professional able to come into the meeting and talk about that?
So I did attach the memo from Dr. Rye to our agenda today. And as we've been meeting both with Brown County superintendents and with leaders in the local community, both public health and the business community, we have relied on really two sources, Brown County Public Health and our medical professionals with Aurora, Bellin, and Prevea. And those metrics have come to us from them. So I did ask Dr. Rye if he could provide some documentation to support that, and I've attached it to the agenda. And that's their recommendation for that gating criteria.
Okay, let me just check that out quick, and then I'll okay, so the Prevea Health. Go ahead. Yeah.
I was going to ask a question while you were looking, but go ahead. Sorry.
Oh, I think I got it here already. Okay, is it this thing detailed Prevea Health 8/3/2020
yes.
PDF? Okay. So did Dr. Rye know that there was probably going to be a question about why the positivity rate is the thing?
I did not discuss him with him that concept.
Because it does, the memo doesn't. I mean, it's a well-written memo. It talks about important things for districts to consider. It talks about, yep, so there's a lot of good things in it, but why a positivity metric is the correct metric is not covered here, other than WHO and CDC said so, and there are problems. So there are problems with the positivity metric, which are two of them. First of all, as I said, if you have, it's really, the negative tests play a very heavy role in how this metric works. So you could have that situation where you had a huge case spike, but if a lot of testing is flooded into the area, that can give you a fake low. My problem with the positivity metric isn't that I'm not trying to pick one metric or another that will get us to more choices for families sooner. It's, I want to use a good metric. You also could have, I know why you use it. I know why the positivity testing metric is important early in an outbreak, because if you're under testing, if you test 100 people and 25 of them are sick, yeah, your raw number is low, but that's a real high positive number. That should be a warning sign to you. But 40-some thousand tests have been taken in Brown County already. So we really have a lot riding here on something that is very influenced by the number of negative tests. And I don't know how I can, I thought we would have someone here that could, if I would be certainly open to listening if a medical professional was able to talk about why now the positive test rate is still the best metric, but in fact, this memo just says because someone else said so. And from a WHO perspective, that's a global perspective. There's countries where the positivity metric is super important because they're under testing. So if there isn't going to be a further explanation available of why the positivity metric as opposed to a cases per 100,000, new cases per 100,000, I guess that affects my being able to, I would need to know why we're picking that metric. So, all right, I guess I'm done with questions about metrics. I have questions on other areas, so I guess I'll step aside if someone else wants to jump in.
Go ahead, Christina.
I have 4 questions, one of which is about metrics, Andrew, so I'm going to jump on what you were just talking about. Do we have a metric right now, Steve, on how we move from blended to fully in person?
No, we don't. And part of it is we're better understanding these, just as Andrew said, as we're working with our health professionals. I know one of the concerns that was out there was that the recommendation is that we need to be low in order to move back to on-site. And low may be, according to at least some of the communication we received from parents and that we heard last night, might be unattainable. I don't have the expertise to know the answer to that, but that's something that as we look at this bridge model of moving from off-site to blended and blended to on-site, that's something that is on the list of things that we need to better understand, so that when we have a timeline for you, once we get into blended, you're going to want to know when blended to on-site happens. And so we need to better understand that. I don't know if low is the right metric for us, given this particular methodology. So that's something that we have to spend more time with.
Okay, thank
you. But if I just add to that, low is, so yes, low is unattainable, and I was worried that low was unattainable. Yep. Mm-hmm. But now the motion has not even a mechanism to contemplate going back to on-site. So that to me is even worse. I mean, at least if we really lick this thing, which I don't, the low would be 24, 26 cases total in 2 weeks. So no, I would be very happy if we hit that even after a vaccine. I hope to be wrong, but that's less than 2 a day. Now we're looking at voting for something where there isn't even a criteria at all. It's not, and we're going to have people very concerned that whether it's what we would intend or not, people are going to look at the written plan that gets approved by the board. And so, yes, that would have been one of my questions if it was in there. I don't think it's the state of Wisconsin's defined low, and I was worried that people might say, okay, you're pretending you might go back to full on site, but you hid that with an unattainable metric.
Well, I guess, and I'd offer that, again, my intentionality behind this was that we weren't intending to usurp any power of the board. And so our intention would have been that when we arrived back at the board table to say we believe it's time to move from offsite to blended, just as we're telling you right now that we think we know what the metric is to make that change, when we came back, we would also then offer a metric that would move from blended to onsite. And again, that we would seek approval from the board for that too.
Can I ask quickly? I just want to make sure I understand what we're voting on tonight. So Christina, your motion was regarding your motion was regarding to us starting virtual in September. Are we voting on the entire plan, or are we voting on how we will start in September based on the benchmark that we've been given by our health community?
Yeah, I don't know if that's for me or for Steve, but the way that I understand it is that we're voting to start the year virtually based upon the recommendations of the health community and the information that's been provided. And also in the motion, it says we will look at this and discuss it at least every 2 weeks. Steve is also committed to sending us updated data every single week so that we are up to date. We have the ability to call special board meetings. So if we wake up tomorrow and the numbers are suddenly down to 0 and the virus has mysteriously disappeared, we could call an emergency meeting on Thursday and say, I pass a motion to start in person. So I personally don't understand why we need to have metrics on how to go from blended to in person right now if we've already committed to looking at this on a week-by-week basis to try to get back to all students in the classroom as soon as possible. And so I believe that's what we're voting on tonight, is simply to start in person or start.
Thank you for clarifying.
And I just offer to Dawn and Eric to extend on that. You know, again, being new and only being a few board meetings in, and if you'll recall, a few weeks ago when we had the conversation about whether or not the board should vote on this, and one of the things I shared with you is that the Department of Public Instruction was pretty specific about that this did not require board action. And through our conversation at the table and afterwards, it was determined that board action was appropriate, and I certainly support that. So then I didn't want to get too far out in front of ourselves and develop a plan that had a lot of autopilot pieces in it that really wound up deferring to administration, when in fact it might be a better choice to have board action. And so as I'm trying to strike that balance, I prefer to err on the side of caution, if you will, and make sure that I've got the appropriate direction from the board before we take any unilateral action.
Christina?
Yep. I just want to comment and then finish up with my 2 other questions. So I think that's what makes this issue so incredibly complicated, right? You can plan all day and have these really clear metrics, but then information changes rapidly. It's like trying to put a puzzle together that the puzzle pieces change and they're all the same color. So, you know, I think this is where we've got to having a discussion on metrics of what is best and what we have now. We've got to hold each other accountable and come back to this information rapidly if needed. We've got to have open lines of communication. And to Eric's point, I think a good plan is solid, but we also have to be able to respond quickly to updated information. And there is, you know, I don't really like to say, you know, just trust us, because that doesn't really mean anything to the community, but there is going to be a level where we're going to have to work together over time to just respond to when information comes forward. So I have 2 other questions. So Steve, we heard a lot yesterday about students and families receiving special education services and that, you know, have an IEP. This was something that I talked a lot about in the spring. Families were very frustrated. So can you please, and I know, you know, we're going to vote on this motion tonight. We'll see how it goes, but can you please talk about what that's going to look like for the fall and how it's going to be different for families and students?
Sure. So one of the things that will happen immediately after a board decision is that our special education staff will immediately work to reconvene IEPs, because regardless of which choice is made, it's going to look different than last year in August of 2019 or any of the recent annual meetings that parents had regarding their IEPs. And so there will be a need for those meetings to take place so that we can determine the appropriate delivery of services. One of the things that we learned as part of this process is that we have students for whom that offsite model simply didn't work. I've used some examples that people definitely understand, things like occupational therapy, physical therapy, speech and language therapy, that we think would be best delivered on site. We also have some students that participate in some programs, some of our students that are in our autism programs who have indicated that they really need on-site assistance. And so our pupil services support team has been working to determine how we can provide those services in a safe environment for those students who will need to be on site. And that would be determined through their IEP, through their individualized education plan. That includes both teachers, parents, and in some case students as they go through and make those decisions. But again, it's that opportunity to make sure that we're able to meet needs on site that can't be met off site.
And sorry, a follow-up. Are you committed to working with the Special Education Council through the district to help best inform your decision-making moving forward with IEP services?
Absolutely. I had the opportunity to meet with them. Sometimes I get my weeks mixed up here. I think it was 2 weeks ago, might have been last week. Had the opportunity to meet with them. They meet monthly. And so that's a meeting that I've added to my calendar to make sure that I understand where we're at as we walk through the process and get some of that direct parent feedback.
Thank you. And then my last question, I know there was a document attached to our agenda about supervision. So this is going to fall on the back of working families, single parent families. We heard from them. Some of the comments quite emotional last night, and even families that, you know, can both work from home. This is incredibly challenging. So can you talk about the district's commitment? I know we don't have the specifics yet, but the commitment that we have to ensuring that we don't have 5, 6, 7-year-old kids left home alone to no fault of the family, but just because parents have to work and they may not be able to adjust their schedule.
Sure. So I think many of you are aware we're part of a subgroup through the Department of Public Instruction called the Big Five. It gives us the opportunity to meet regularly with the superintendents from Madison, Racine, Kenosha, Milwaukee, Green Bay. So at our last meeting, that was actually a central topic of communication, was providing both wraparound services if we had some on-site instruction, and if we didn't have on-site instruction, because I believe now all 4 of them have committed to starting virtually, then what would wraparound services look like when education was in a virtual environment. And so got to hear a little bit about what Milwaukee's doing and what Madison is doing, brought that back here, had a conversation with our folks about some of those support agencies that provide wraparound services for our students. So the questions we've been asking are, do they have the capacity on site at their facilities to extend those wraparound from before and after school to during the day? Also had conversations with them about where they're providing those services on site on our campuses. Can they also expand those to cover daytime support for parents? And then the other thing that we've been talking to them about is expansion. So do they have the capacity, do they have the ability with their organization to either expand on site at their own facility, and if not at their own facility, either other facilities in town or perhaps inside our buildings. We have obviously some challenges inside our buildings because depending on how we structure those services, rather than falling under the auspices of the Department of Public Instruction, they fall under the auspices of the Department of Health Services. They've got some different rules for that. But those agencies that we work with, our partners, have been very creative. They're definitely willing to work with us on that. We think through that process, we can expand the number of spots that are available for parents to receive assistance.
Sorry, Laura, I have a follow-up real quick. So Steve, I've had some families when they're asking about this, they'll say, well, if you're going to do that and have supervision, or how is that different than just them going to school? So why not just have them go to school if you're going to do that? Can you explain the difference?
Sure. So if you haven't had kids in our wraparound programs before, that might be an area that's unfamiliar with you in terms of how that's structured. So we tend to use common areas for those. So think gymnasiums, cafeterias. They allow certainly some physical distancing in there. DHS has specific requirements in terms of square footage per pupil. And so that's going to look obviously different than a classroom does. With this current environment, those square footage requirements are changing. And so that gives them the opportunity to comply with those DHS requirements and service students in those common areas in our schools. So that's going to look different than it would be if you had kids in a classroom like we experienced and we were able to show you on the video today.
Thank you.
Christina, one thing I'll just follow up. I talked to the executive director from the Boys and Girls Club today because they've been serving kids this summer. They've been operating on a ratio of 1 to 9 all summer and minimizing obviously any interaction between those different pods. So just another example of how that's different than maybe what we would be able to do.
Thanks, Eric. I appreciate that.
Yep. Laura, go ahead.
Just to build on that a little bit and to widen that, I, you know, I know we've talked a lot about our community partners, and our community partners are committed to children in our community. They've done amazing work, and I know that we're growing that, and we're going to continue to grow that. We need it. We need every bit of it. But I guess my thoughts on that, if we can expand it even more into our community at large, that our families are going to need, no matter how we vote tonight, they're going to need employers and businesses in this community to offer them flexibility and to show empathy for the situations that we find ourselves in as a community right now. And I'm hoping that if people in positions of leadership are watching this right now, that they will give that some consideration, because it's going to be desperately needed. Our families are in crisis, our community is in pain, and as we, head back to school, there's a lot of fear and anger that we hear them in all of these emails that we've had. A lot of trepidation. So I'm hoping that if I think it's essential that employees in our area adapt and offer that flexibility if possible. And I know that might seem really challenging because businesses have to be viable. But I think that unity as a community is going to be really essential if we're going to come out on the other side of this pandemic intact as a community. And I just hope people will give that some thought. So I just wanted to offer that.
Maybe one thing I could add to that too, because I think that we recognize that we want to be a part of the solution. And we've heard from parents that have said, hey, I may be able to find a reliable location for childcare during the day. But if the expectation is that I'm going to go to work all day, my kids are going to go to childcare all day, and then I'm going to try to pack an entire school day into that after dinner hour before my kids go to bed, that's an unreasonable expectation. We certainly understand that. That group that's working on this issue has been being real out of the box thinkers, if you will. They're looking at it and saying, if our teachers are busy teaching during the day, we've got many high quality support staff, paraprofessionals, special ed paraprofessionals, other certified staff who may not have a teaching responsibility. And so the question they've been asking is, can these staff members through outreach help those organizations, help those children stay engaged with teaching and learning during the day when they're in that childcare setting, so that they can participate in that online learning, so that when they come home in the evening, parents aren't trying to pack an entire school day into that after dinner hour. So certainly not fully planned out and ready to go, but that's definitely a part of that process that team is working on.
I think it's going to be really important going forward that we show each other and our fellow citizens some grace and some kindness and patience and all those old-fashioned virtues that we take for granted, but in a crisis situation become incredibly important. And our district can't do it all. We can't provide everything for everybody. So our teachers are amazing and our staff is amazing. I think we can all agree on that, but they're human, and we're going to need a whole entire community to come together to make it through to the end.
Thanks, Laura. Go ahead, Rhonda, and then we'll go to Noah.
I have a few questions I want to ask about just this conversation in general. So Steve, you had said that you had asked the community partners if they have the capacity. You had asked if they can provide services on their on our premises, right? And do they have the ability to expand? When will we know the answers to this? Because personally, speaking for myself, knowing everything that's been out there that has come to us in emails, people that were speaking, the phone calls I've had, when will we know that this is even an option? Because I feel like that's something that matters with this vote for me personally.
Understood.
When do you anticipate that they would know that? And do you believe that they could actually handle a pretty large capacity? And who's going to determine who the kids are that are prioritized to be able to go into these programs? Who actually gets to determine that? Because I think it's a pretty relative situation for kids who are in need of support. I think we could probably all agree that that could be a very large percentage of our district, especially when we talk about working families. And what's the criteria going to be when we ask for students who are in need for extra support in general? Because right now, I don't know how that's even possible. And if we don't have some sort of an idea of if it is possible before we're voting on this, I'm not sure what we're waiting for. And what are they waiting for? Can you explain more about that?
Sure. So our team reached out to them. They've engaged in this dialogue, but obviously that this isn't something that they have ramped up or planned for, because they're waiting for the board to determine what their next step is in terms of either an offsite or a blended model. Because if we're running a blended model, obviously we're not going to have space in our schools because we're going to have kids in there on a rotating basis. And so that takes away those common spaces that they would use to provide support. So they've had those conversations. Those partners are interested, they're ready, willing, and able to determine what their next steps are. But absent actually knowing what type of space is available, they don't have the ability to plan for that right now. So many of those decisions and much of the content that you just referenced is something that they're literally ready to go in terms of initiating that tomorrow. But absent knowing what kind of spaces are available, they haven't moved forward with that process yet.
Do you anticipate families having to pay for these services?
To be honest with you, we haven't gone far enough in that into it for me to know that.
Okay. Here's
Sorry, Rhonda,
question.
in that one document, there was some costs associated that was outlined. And so it looked like something that could be something the district would absorb, but I didn't know if you saw that.
I did, but I again, this is another one of those things that really matters to me when I think about creating more hardships for families, right? So it does matter to me before I take a vote. Do you feel you have enough staff who would be willing to work in a blended model?
Well, not knowing how many students we would have on-site or off-site, it would really depend. If you had all of our elementary students elect to come to school, we'd have to hire 400 plus teachers in order to do that. But the reality is we don't have enough space to actually place those teachers. So if all of our elementary kids decided that they were going to come to school in a blended model, we would have to have all of our high school kids off-site in order to free up enough space to put our elementary kids into classrooms. And then we need to hire 400 teachers. And to be honest with you, we don't have the money to hire 400 teachers. So it really would depend on what the mix of on-site and off-site students is in a blended model.
So if I'm hearing you correctly, what you're saying is you really cannot realize the blended model. I mean, just hear me out because I want to understand. So if we're into an offsite virtual start in September, and we're looking at gating criteria on a regular basis, and somehow something, things are going well, and we have to come together to decide if we're going into a blended model, are we going to have to hire 400 teachers to make that happen?
Well, we don't presume that everybody's going to return to class the moment that we move from an offsite to a blended model. And so part of the planning process is determining how best to meet the needs of those students who do come back. And the hardest part of the process is going to be when you're in flux between blended and on-site. Certainly as we get closer to on-site, we presume that more and more of the students will elect to come back to school. And hopefully also during that part of the process, if we see a reduction in the community spread, that may very well change some of those criteria. We looked at spacing classrooms out from 6 feet to 3 feet. And if we start to see that rate of community spread decrease significantly, and we're therefore able to decrease the spacing distance in the classroom, that significantly increases our capacity. And so part of our thought process is, as we move from the blended model to the on-site model, some of those metrics that the CDC and healthcare professionals have provided to us are going to change. And that change is going to allow us to have a higher capacity for students in the classroom. And so we think those things will come together. And then we think that then we will have the ability to do that. Now, in today's current model, with the requirements that they're talking about with the 6 feet of spacing, our geography limits us to how many children we can put in a classroom. And if we have to find a space for every single elementary child, then that's where we start to struggle with having enough staff.
Okay, so, but again, just so that I'm clear and I'm understanding what you're saying, in order to go from an offsite virtual model, let's say maybe in November, just throwing it out there, do you believe we would have to hire 400 teachers?
No, I don't.
You don't.
I said, if we were to do it today, with the community spread that we have and the recommendation that we have from the CDC, that's the position we'd be in today.
Oh, so just today. Okay, so, but I think that's a really important point, right? Because the vote is to accept the recommendation, but it's for an offsite virtual model where people are weighing, and I don't even think families understand that, right? So if the board, let's say the board doesn't accept that, then we are simultaneously saying, we believe we can hire 400 teachers.
No, we'd come back to you and say, in order to accommodate, well, first of all, we'd have to reach out to the parents and say, how many of you want to be offsite? Because remember, we offered parents the opportunity to be offsite as long as they wish to do so. We know that we've already had 10% of our parents that have said that they plan to be offsite, regardless of what we do. And so we would need to ascertain just exactly how many parents would send their students to school. Once we know that, then we know how many teachers that we need. We know how much physical space we need in each building. And from there, we would then be able to tell you where we stand.
And do you believe that you would have had more families sign up for that the offsite option if there would have been more of an explanation of the actual program?
Oh, sure. Yeah. Well, I don't know if I say we'd have more, but obviously more information is always better as part of decision making. I don't know if that would have had more people sign up for that initial run, but I'm sure that they would have been better informed.
I've been hearing from a lot of people that they would have, if they would have known a little bit more about it, they maybe would have committed to it. Mm-hmm. And is that still, if the board votes tonight to accept the offsite virtual recommendation, then people signing up, I think the deadline was the 7th of August, then it doesn't apply. People
That's
cannot
correct.
choose. So tonight, if we accept that, because that's been confusing as well, parents have been thinking they can still choose.
Yes.
So in a blended model, can they choose virtual?
Yes.
Or is it just they can?
Yes.
You can be fully open and they can stay virtual. Some families have indicated they want to do that for the year, just health conditions, whatever, we're just going to let them.
So
That's
even
correct.
even in a blended model, families could choose virtual.
Yes. So maybe the best way to think about it is if you were part of that 10+% that said that you would prefer to be in an offsite model, regardless of which choice you as a board make, whether you accept that recommendation and start offsite, whether you decide to vote for blended, or whether you decide to make an alternate motion and start with every child in every day, those students whose families have selected offsite, they would be able to start offsite, and we've promised them that they will be able to stay offsite as long as it fits their educational needs.
Okay. I also have a question. So do you have the ability, or would you, if the, let's say the board voted one way, they didn't accept your recommendation, do you have the ability to overturn that yourself?
Oh, absolutely not. No, that's why we brought it to the board for a
Okay,
vote.
someone asked and I wasn't sure. I didn't think so, but
No.
that was another question. I also want to know what you think about when it comes to the gating criteria. Do you believe we're handcuffed by the amount of testing that's available?
Oof. I don't know the answer to that, Rhonda. That's a good question, but I don't know the answer to that.
Isn't that an important thing to consider?
Again, you know, our expertise with the teams that we have in place is really about how to deliver teaching and learning. And we've really relied on our external healthcare providers in the Department of Public Health to tell us when it's safe to have our kids in class. So we really rely on those folks to help us know when it's safe to have children back. When they tell us it's safe, we'll be ready to have them back. In the meantime, then it's our job to, again, determine how best to provide educational opportunities for them offsite.
Okay, I have a question about food delivery in general. So last spring, we had a lot of families who were not working because of the stay-at-home order. And so there were a lot of families able to come and drive and pick up food. We know that that is not the case today because a lot of people are back to work. Most people are back to work, in fact. So knowing that, what is, I'm really interested in, because this is, we know there's parental insecurity. We know there is food insecurity out there. On any given week, I have sometimes my daughter's friends who end up in my home because of these reasons. So I have seen this firsthand. I'm wondering about the options that will be out there, because it is very likely that a lot of families will not be able to drive to pick up food, especially if they're working. And so my concern is that there are going to be a lot of kids who are not eating food. We were not very flexible in the spring when it came to teachers being able to deliver food. So I'm wondering what type of variance is going to happen when it comes to our staff being able to reach families, because again, you might, and we know this, there may be kids home by themselves and they're 6, 7, 8 years old because of this decision. And so those kids are not going to be able to potentially walk 5 blocks to get food. So when we talk about safety, I think this is a very important consideration. What are we willing to do? Because this is an important part of my decision as well. For those families who will not be able to drive to the sites to receive food. And how committed are you, and I'm asking you personally, how committed are you to making sure that our district is more flexible when it comes to teachers knowing these students, having relationships, and being able to reach them with food delivery? Because we were not flexible last time at all.
So again, not having been here, I'm not sure I can speak to the past, but I can tell you that in working with that particular group in the operations area, they are committed to multiple opportunities to ensure that kids are being fed. So they're talking about those opportunities, as you described, to come to central locations to pick up food. Those may or may not be our facilities. They may be other places in town that have been identified as better places, more accessible for people to pick up food. And then they're also committed to that idea of delivering food so that, as you indicate, whether it's, it could be teachers, it could be building administrators, it could be advocates, it could be people in the community that work with populations in need that are helping us identify who those kids are and who those families are. But they are 100% committed to going beyond simply providing food for pickup, but also providing delivery options so that we can get food out into the community to people who need it.
Do you see teachers as being part of that equation?
You know, if teachers are teaching, they probably aren't necessarily going to be part of that delivery because they may very well be tied up during the day with instructional responsibilities. But again, as I shared before, we've got a great support staff. This might be an opportunity for us to repurpose some of our support staff to provide that function in the community. But I know our food service team has really stepped up and said that this is something they can do.
But there were, and I'm not actually asking for teachers to be instructed to do that, but there were several teachers who wanted to and were denied the possibility. So I'm hoping, I'm suggesting, I'm asking that we are more flexible with those, because I think we're going to have to be.
Yeah, well, I think as Laura said before, right, it's all hands on deck. And so I think what we really want to do is we want to make sure that we take advantage of those people whose passion is directed towards supporting our students.
Ron, I'm going to jump in just to make sure that we can keep everyone engaged. I want to make sure you get all your questions asked, but I also want to make sure that the rest of the board members have a chance. Noah, you had a question a few minutes ago. Do you still remember what it is?
Yeah, thank you. I have a couple of things. All right. First, they're similar. First one is what will lab science courses, academic courses, etc. What are those going to look like, and will they even still be offered?
So first of all, let me thank Noah. He took some time out of his weekend to talk to me and share some of the feedback that he's getting from students. I really appreciate that. And one of the things that we had talked about was what about some of our more specialized courses? You mentioned science classes and the labs that go along with them. We also talked about things like our career trade and tech ed classes that may have some very unique educational requirements that can only be met on campus. So right now our ed team is looking at those to determine if there are opportunities for us to bring students on campus in smaller numbers. And they certainly don't have that planned out yet. But that was something, Noah, from our conversation, I was able to take back to the team. I'm going to have a chance to go over later this week and take a look at the aquaculture program over at Southwest. As I shared with Noah, I don't want kids digging ponds in their backyard. So how can we actually create opportunities for students who are in those programs to continue in those programs? For many of our kids that may be on track to graduate this year, this may be their last opportunity to complete some of those. And we want to make sure that where possible, we provide those opportunities. So we don't have any answers for that yet, Noah, but that's high on the top of the list of that academics team.
If I could, I'd also just like to throw in there, because it's also been said to me, performance courses, so music, the Fine Arts Academy and things like that. Those have also been similar concerns, because we tried the Pledge of Allegiance over Zoom a few meetings ago, and with the whole orchestra. Yeah, so and that was that. And then I'm going to say the metric word, I'm sorry. There's, in this motion, there's no metric for in-person, but then the graph, when I look at the plan that was released, has like a cycle of all three, depending on what COVID looks like. But at the end of the day, there's nothing in the motion, and I have a high, I look at what's written down significantly, and so I don't know what this is looking like to students who have read the agenda. They said this is an indefinite postponement of the school as it used to be, and probably pretty close to indefinite postponement of even a blended model from what's here. I don't see school coming back to in-person learning of any sort happening easily, and certainly not when there's no hard trigger in it. There's nothing where we can say, okay, the math works out here, or there's nothing where we can say, oh, the date has been reached, so now we can come in person. So the public, the students, have no idea what this is, and this looks like an indefinite timetable. I guess I'm not really asking a question. I'm just kind of throwing it out there that from what this looks like to students is that school's never coming back. That's what that looks like. That's the perception. Whether that's true or not, defend that if it's not, but that's what it looks like. Thank you.
So first of all, I'll go back to your fine arts question. So one of the things that the academic team is looking at is, in particular, what we consider our specials, art, music, and PE, how we have the opportunity to continue to keep students engaged in those areas, even if they're in a virtual environment. And our staff have been exceptionally creative about that. They think they've got some good opportunities for kids to continue. They actually even, we started with the idea that we were going to postpone introductory band just because they were struggling with the idea of how kids choose instruments, how they get fitted, et cetera. they've actually got a workaround for that and have already come back and said if we start in an offsite model, they want introductory band to start right away, day one. And so I've got a great deal of faith in their creativity and their ability to figure out a way for us to do fine arts, including fine arts extracurriculars in a virtual environment. And in regards to your last one, I'll go back to the comments I offered earlier. We really thought about this in terms of a staged process. I can certainly understand from your perspective without seeing something for that final stage that the appearance may be that there is no plan to return. And I would just tell you that that certainly is not the case. We were simply looking at step 1 to step 2, and that's the detail that we drilled down on for this one. Our next step then is to do step 2 to step 3, which is the blended to the virtual. We're blessed with about 100 people that are working on those 8 teams, and their next work product is to actually then build out that next transition. They simply just didn't do it at this point in time because of the fact that we only had 4 weeks to work on it.
Christina?
Thanks. This question is for Terry. Terry, can you talk a little bit about some of the struggles if we were to go back blended or in person in September that we could face with our subs, with people getting sick, with supervision of classes? I know we've historically at the state and national level had a sub shortage. So how would this exacerbate that already existing issue?
Thank you, Christina. We are continuing to work with our substitutes to gauge their interest in continuing to serve the district. We do that every year. We, several weeks ago, sent out a substitute survey, and we have HR associates reaching out to our current substitutes, speaking personally with them as well, understanding how important that topic is. And there are a variety of factors that impact the substitute shortage nationally as well as state and locally. And we've been doing a lot of proactive things to increase our sub availability and utilization. This absolutely will have an impact. We do use, many of our subs are former district teachers. So they are retired and either completing their emeritus or they are choosing to fill in for long-term substitute positions. So obviously the pandemic will have an impact on their willingness and availability to be able to come in. We also have experienced already impacts on our workforce relative to the following the health department and the need to quarantine, both for themselves having a positive COVID test or for a spouse or someone living in their home who may have actually been exposed in another community employer. So that impact goes, both directions, where we have an impact on with our employees and their impact on their spouses working out in the community, and the same back in the other direction. So the potential there is that an employee could be off themselves for a 14-day quarantine, and then an additional 14 days while their significant other or family member in the home is quarantined, and the impact could actually extend over a number of days.
And thank
Can't
you,
they
Terry.
can't they test and get out of quarantine?
We have about 25 different scenarios relative to COVID exposure, and I would really encourage looking at that carefully because each situation is very different depending on the closeness of exposure, depending on the testing timeline, depending on a number of factors. So again, we're following the advice of our healthcare and medical professionals in the Brown County Health Department, et cetera. So, there's a number of situations that would have an impact on that answer. And we did recently communicate that out with all staff. And I believe we're up to about 25 different scenarios that, we could talk through. So,
but you're not saying that you can be quarantined because of a potential exposure, test negative, and return to work, that is not a for sure thing?
There's a number of factors that would impact that, Andrew, depending on how many members there are in the household, when there's symptoms, if they have symptoms, if they don't have symptoms. So, again, the document outlines a lot of different scenarios, and we have a team that's working through these case by case and really looking at all of the impacts. Melissa, because I know you've been very closely involved with those as well, do you have added information that would be helpful?
Sure, thank you, Terry. Andrew, we shared that communication that went to staff, I believe it was last week, with respect to those different scenarios. So you could go through those scenarios, and if you have any additional questions, you can give me or Terry a call. But in working in partnership with the Brown County Public Health Department, as well as our other community healthcare providers, we've outlined all those various scenarios. And there will be times when an employee tests negative for COVID, but a member in the household may be positive, or the individual has come into close contact with someone else who's COVID positive, and they will still be required to quarantine based on the requirements of the health department and our community healthcare providers. But after you review those 25 scenarios, if you want to give us a call, I'd be happy to walk those through with you.
I have two additional questions, sorry. And within that scenario, I can't remember, is there an exemption for the number of hours a sub can work in a year? Because isn't that currently exists, Terry?
I'm not sure what you're referencing. It would depend on their licensure. It depends on the length of time that they're able to sub in one particular position. They must have a license in that area if it exceeds a certain number of days. So that impacts the ability to long-term sub. And it also would vary based on their emeritus. So we are required to have a certain number of days break in their service before they are eligible to come back to substitute for us.
Thanks, Terry.
And they're talking about changing that, but they have not done so yet.
I was just going to offer, that's one of those things that we brought to the DPI last week, and they said that they would see what they could do in their rulemaking capacity. As Terry said, that might be something that doesn't require state legislative action for them to waive that sit-out period.
I just have one last question. Steve, you had mentioned today, and I think you said 10% when we were talking about the number or percentage of staff that could put the whole system in jeopardy if they are to get sick. Perhaps even one specific building or the entire system because of supervision and licensing. So can you talk a little bit about that? Because I thought that was a really important point.
Sure, that came up when we were at the building, and I can't remember, I apologize. I know somebody asked the principal about that, and she was describing scenarios where in the past, if you had somebody who wasn't able to come to work in the morning, or had to leave at the end of the day, there was always the opportunity for us to double up. It's certainly not ideal to send the students from one classroom into another classroom, but it ensured that we had certified supervision of those students and that they were able to continue with some kind of teaching and learning, either at the beginning of the day or the end of the day. Obviously, that's not going to be possible in this kind of scenario because we need to be physically distanced and we can only have so many students in a room. Then you would turn to the other certified staff in the building and have them step in, the principals, counselors, maybe specials teachers, et cetera. And then beyond that, you run into a problem because if you simply have other adults in the building that are standing in, they're not certified, that doesn't meet the Department of Public Instruction requirements. And so the question that was asked and that she was helping us answer was, how many additional certified staff do you have in the building who could fill that role? And the number, the kind of the rule of thumb that we've been looking at out there is in any given building, if you reach a 10% absenteeism rate, we're going to start to lose having the actual appropriate number of adults in the building to supervise the students in the classroom. And so when you get to that point, we're in an unfortunate situation where do we actually have to curtail education in that building for the remainder of the day? And then are we actually contacting parents and sending kids home in the middle of the day? Certainly is a worst case scenario as we're trying to figure that out. There's the possibility that on an individual basis, we could scramble certified staff from other buildings to help out with that. But if that starts to happen in more than one building at a time, we're going to lose the ability to keep up with that. And so right now, and I've actually had this conversation with superintendents around the country, and this 10% rule is kind of that rule of thumb, if you will, that's out there, that if we have that level of absenteeism of certified staff, we start to get into a challenge in actually running school.
I'm sorry, I have a follow-up question. I don't know if this data exists right now because we're learning and collecting so much new data on the daily. Is there any modeling yet that exists with when you open up schools with the rate of infection and positive cases, how quickly that 10% threshold would be met?
I haven't seen that yet. I can tell you that I'm really worried about the rate of spread when you have teachers together. I don't know if anyone saw the story that came out of Georgia. Gwinnett County just had an enormous challenge. They brought staff back on site and immediately wound up with almost 300 teachers. They had to quarantine for 14 days. They're very close to the start of the school year because they start earlier than we do down there. And obviously that puts in jeopardy the ability for them to get school started because now these folks have to sit out for 14 days. So those are the kinds of things that we looked at. So not only the student safety, but again, staff safety is a big concern for us, and then having adequate staff. You know, if you have 10% of your kids who are out because they wind up being sick, we can accommodate that. When 10% of the staff are out, that's where our struggle starts.
Thank you.
Christine, I would just add that I had conversations today with our reps from First Student and from Lamers and asked very similar questions about bus drivers, already a shortage of bus drivers. You know, I proposed a scenario where a bus driver brings students to school, maybe gets test results back that they tested positive, can't go and pick up those kids. Would we run in a scenario where kids would get stuck at school without a bus driver? They assured us that they have mechanics and other people in the shop that would be able to drive, so that wouldn't happen. But the shortage of bus drivers is incredibly real, and you know, possibility of students not having transportation to school. It's very easy to imagine that scenario happening quickly.
There is a New York Times map that that shows by county across the country how many people in the school would be expected to arrive to school infected. I can send the link out to board members. But in Brown County, 2 people would be expected to arrive infected at a school with 500 people.
And I think actually, Brenda, it's 2 to 4 in a school of 500 and 4 plus.
Oh yeah, actually 1 to 4 it says. Range of estimates is 1 to 4, and they're saying 2. So and most of, I mean, Wisconsin has varying variability with that. There's one county that were 9 to 30 would be expected to arrive infected. That's in the far northern part of our state. So it's an interesting map to kind of show you where the caseload is across the country. But I'll send that link right now.
Thanks, Brenda. Question for you. Are they then able to look at that data and track it spread, or does it not go that far?
I think they're just using, today, and I assume that they'll modify the map as you move forward. But I think they're just looking at, gosh, I'm not sure. Let me see.
I think they're using
if it's burden. Do you know if it's case burden or is it infection rate?
I think it's infection rate. I think they're using the National Institute of Health data, and the modeling actually comes out of the University of Texas in Austin.
Yeah. Yeah, here it says the projections are rough guidelines based on the estimated prevalence of the virus in each county. They reflect current levels of infection, are likely to change. The estimates assume that children are as likely to carry and transmit as adults, which they admit is maybe a large assumption based on the, we don't have enough data to really know the answer to how much kids transmit. Although I know there's one study that showed that 10-year-olds and older transmit the same rate as adults. That study came out of South Korea. I think there's more, it seems like there's more and more incidences that are questioning more and more instances that are leading us to say, well, maybe kids are more infectious than we think.
Go ahead, Rhonda.
So to that point, is there any reason why Brown County isn't releasing any sort of data around like the age breakdown of the cases? And would it be possible to get that?
You know, that's a good question. I'll be honest with you. When I was drilling down into the data set, I didn't look at it in that granularity, but we can certainly see if they've got it reported on the state database at that level.
Well, and because isn't it right? There's a lot of debate with that. There's a debate with that, whether kids are more likely to transmit to. So if we actually have data, wouldn't that take care of that argument?
Well, I think that we might know what the infection rates are by age group, but I don't know if that would actually answer the transmissibility issue, because I know that they're still doing research on that. So I don't know if it would answer that.
Well, I guess so maybe I'm not saying that correctly. And I'll rephrase it. So I'm just wondering if we just have something relative to age in general, especially for elementary students. People, there's a discrepancy. There seems to be a lot of maybe just miscommunication. I'm not sure what's going on with that, but there's really nothing definitive that's in the county data that I've seen or that's been released. Have you asked about that at all?
I guess I'm not sure what I'm asking about there. When you say definitive, I'm not sure I understand.
So anything related to a breakdown with regards to age. I haven't seen it. Maybe it's been out there. I just haven't seen it.
And that's a good question. Like I said, I don't know the answer to that because we weren't looking at it from that standpoint. We were simply looking at it in terms of the community infection rate and the burden in the community, as opposed to looking at it by specific age bands within the community.
Yeah, I just think it's an interesting thing to think about. So I have a question as far as when it comes to paras, noon supervisors, monitors, bus monitors, student learning advocates, staff that's in schools typically. What do you see happening with the offsite virtual model with a lot of these staff members, custodians, facilities, staff members? What do you see happening with them?
So I think it depends on the employment category, but I think that's where we've actually started to get some creative input from those planning teams. So if you're talking about delivery of food, again, that's an opportunity for us to use staff in a different way. If you're talking about our staff being able to do outreach in our community partners to assist with online education on their locations, at their locations rather, again, that's an opportunity for us to look at repurposing staff. So the intentionality right now is recognizing that needs are great. It's how best to deploy those staff people to support our students.
And so when it comes to the potential for community partners helping us support students, okay? We heard from a lot of families through email. I know the survey tends to be labeled as outdated, so let's just take that off the table, right? Even if we did that, we still know that every board member received a couple hundred emails from families who are really concerned and struggling with the idea that they do have to go to work. They don't have flexibility with their employer because especially if you're in healthcare or in the service industry, there's not a lot of flexibility there. That's just a fact. So when we have families who are pleading with us to understand that this offsite virtual option is just that. It's not a solution, it's an option. And this option may in fact solve some problems, but it will create many more for other families. And we know this, they've told us. And I think instead of saying that they may be unhappy or they might be angry or they've been accused of whining. The reality is they're desperate, out of options, and hopeless. And I want people watching to know that I absolutely feel you in that. It's important to recognize that we have many working families who may not make the cut for the community partner on-site support. And it's entirely possible that will happen, because if we could accommodate that many families, we probably would just be having school. So I'm interested in what I'm supposed to tell these families when it comes to the stories that we've heard. They're both working full time, or it's a single parent who can't quit their job and their kids are now home alone. And it is a fact, and I've gotten crap about this, but I absolutely believe this, that not all kids are safer at home. And that's a fact. And what are we supposed to tell families when they don't have answers? This offsite virtual option that is recommended does solve some problems, and it gives answers to some families. It absolutely does not do that for many other families. And that matters to me. I'm a single working mother. I feel their pain. I cannot imagine making those decisions where they're probably going to have to just walk off and say, well, good luck today, or you're going to have to go to daycare or some other facility. And we know a lot of places won't take kids over the age of 12 for all kinds of reasons, and state, I believe even state laws. But if these parents don't have options and their kids are ultimately home by themselves, and we're looking at attendance and we're checking the boxes potentially on that, I'm not sure how the grading is going to look. We know the needs are out there for mental health issues. I think I'm the first person to bring that up tonight. It's out there, significantly, by the way. I have a really hard time. For me personally, this becomes a public health issue with the pandemic, and another potential, and I think likely public health issue, with families basically being left with no devices to work through this. Working families should be considered and validated and honored and not shamed because they have to go to work. And if, in case people forget, their salaries pay taxes for the public school district to actually stay afloat. It's literally a lifeline. So I'm really struggling knowing, and it's not a secret, we've heard from people, we know this, that they are desperate for answers. And I believe, in what I struggle with, and believe me, I've had no sleep about this because I feel terrible about that. And I'm not discounting that I'm not a COVID denier. I'm a mask wearer. I wear it everywhere I go in public. I work 6 to 8 hours in one every day. And by the way, there have been teachers who have asked, if you vote against the offsite virtual option, I sure hope you come into my classroom. And I would absolutely do that. I just want to go on record saying that I would do that. Because guess what? I have to go to work every day. And I have for 3 months. Wearing a mask, mitigating risk, because I do not have the option to stay home. I have to provide for my family. And so I can imagine that there are a lot of people out there that are struggling with this decision because they don't have the option to do that. And I just really I'm not hearing enough about what to do for those families. They matter to me a lot. And I think they should matter because they are our lifeline. They basically provide the revenue that we need to stay afloat. So I can imagine a lot of outreach from them asking about what to do when this happens. The conversation has been that the public schools are not childcare. Technically, they're not, but realistically, we know that a lot of kids are safer in schools, and that's just a fact. So to diminish it into an argument about the fact that we're not daycare and childcare, no one is saying that. What it is families have to get through the day. There will be kids who will not be able to participate if this is completely offsite and virtual. And I am not hearing what teachers are saying, right? But they have a union to represent them. And they've basically been represented. We need people to represent working families who will not have options. They don't have a stay-at-home mom or dad. They don't have a friend who could help them. They don't have a support system. And there's plenty of people like that. That's not politics. That's just reality. And so it's very, very difficult for me to sit here and think about, it is a very difficult decision. It feels like an impossible decision. But I plan to represent those families tonight. And it's not because I don't believe that teachers are not comfortable going back and they don't have a right to feel that way. That is not where I'm at with this. But I was elected by my community to represent them, and I fully intend to do that, because it's like we forgot what they were discussing. We don't really have anything to offer them, and whether that is our fault or not, it's true. And I want to be very clear. I mean, I personally don't even feel that we are prepared to do anything other than offsite virtual. I mean, that's just in a nutshell how I feel about that. I think if we were actually going to do that, I don't think it would even go well. But I want people to know that I've heard you, I feel you, and I honor and validate what you are thinking and saying and scrambling and trying to figure out. And it matters to me because I've yet to hear anything, right? I've heard that they're basically going to be held to the same standards, yet we're taking their safety net. In what world is that actually equity? I don't see that at all. And I'm trying not to be over emotional about this, but it is.
So Rhonda, what do you suggest?